everybody. Nyron Burke, co-founder and CEO of Lithero. One of the questions that I just got it this morning in a meeting with a new partner that we're forming. And I've been having multiple meetings with this person, and they said, hey, how did Lithero come about? Like, what's the founding story? And I thought I would share that with you all. It's a fascinating story. At least I think it's fascinating. But like most founders, the founding of Lithero came from my own personal experience. I was a consultant. I was working at Accenture for a large pharma company, global pharma company, top 5 pharma. And I was on the technology side. I was running 2 platforms at the time. One was sort of a content review platform. The other one was a content reuse platform. And the client, same objectives that Lithero ended up focusing on: speed, cost, compliance, right? That's what they were trying to accomplish with those platforms. But the kind of kernel of what became Lithero came from an experience I had where this client was launching a drug. They were launching a diabetes product. They had just come out of a kind of a dry spell from R&D, and they had this new product that was about to be approved by the FDA. And so the entire company, the client, was super excited about launching this drug. And because I was responsible for the review platform, they had a lot of review to go through, and they wanted to make sure that the platform was going to support them well. And they had a crunch time, like a lot of launch, it was crunch time, because the label that they got from the FDA for the drug was different than what they thought it was going to be. And so they had to revise around 200 pieces of content to get it out the door. And so I'm leaving the office, I'm about to go home, and the client runs up to me and says, hey, can you stay? We want to make sure your platform is going to support us as we do this. And so I'm like, sure, happy to help. Anything for the client, right? And so I'm sitting in a conference room at 2 in the morning, watching the marketers, watching the medical reviewers, the agency partners, the VP of marketing came by, and they just sat there with all the pieces in a projector, and they were going manually, line by line, reference by reference, checking the risk information, checking the side effects, checking out all the things. They had to go through and manually make comments. And the agency in real time is trying to make updates based on what they're seeing from the reviewers. And they're just going piece by piece, page by page, hour after hour after hour. In that experience, I was sitting in the back of the room just watching this, kind of a spectator, and I was thinking, this is crazy. Like, the amount of money that's being spent, the high level of talent that's being applied here, they're so expensive, right? Versus a human resource and just money being spent. And so that got me thinking. It was 6 years later before I started Lithero, but it just got me thinking of, wow, this is really, really expensive and time consuming. And I want to go home, it's 2 in the morning. And so as I did more consulting, talking to brand teams, talking to agency folks, regulated, everybody throughout my career, focused on those 3 issues: speed, cost, compliance, I saw the same thing. And I also noticed that it was very repetitive, that a lot of the comments that were being made were the comments that had been made on other pieces. And so I started thinking, well, what if there is a way for us to reduce the amount of time, the amount of human effort, the amount of financial investment, and learn from all those comments and all that feedback and everything else that is going into this process? What if we had a machine, right, that could look at all that great data, learn from the humans, and then help with that process? That was the vision. It was a crazy vision. I thought it was going to be pretty fast and easy to create. It was not. It took us 6 years of PhD level research to get there. But that's how Lithero started. It started in a conference room when I just wanted to go home and see my family. And then observing that everybody kept doing it the same way over and over and over again, and just dreaming and wondering, is there another way, right? Is there some way for machines to help us humans do this more effective, so that we can put more money into R&D, so that we can reduce costs for patients, so that marketers and brand teams and agencies can focus on things they want to do, which is be creative and engage people, and not just like find errors in documents, right? Just free people up. That was the whole idea. And so even picking the name Lithero is a reference to liberty, to freedom. That's what the word means. It's from a Greek word, eleuthero, which means to set free, right? And so that's the idea behind Lithero and how it all got started. So thank you for listening. And again, if you want to learn more, check us out at lithero.com.